I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. Over the past week, there's been one question that keeps popping up again and again in the comments. Does masturbation affect male fertility or sexual performance? A question that sounds simple, but actually opens up a maze of hormones, physiology, and personal habits. This isn't just a private matter. It's something that could determine the quality of your sex life, your ability to have children, and even your confidence in relationships. And today, to break down all the confusion and give you answers based on the latest medical evidence, we're diving into a topic that almost every man has experienced, yet very few dare to talk about openly. Can frequent masturbation lower your sex drive, cause erectile dysfunction, or even affect your chances of having children? The answer might surprise you and could completely change how you think about this habit. So don't take your eyes off this video, because the next few minutes might just reveal something no one's ever told you before. Have you ever asked yourself, how much masturbation is too much? Once a day? Twice? 5 times? I've read hundreds of comments, and the truth is no one's the same. Some men hardly ever do it. Others see it as an essential part of their daily routine. And most fall somewhere in between. But the real question isn't, am I doing it too much? The real questions are, backhand index pointing right, is it affecting your daily life? Backhand index pointing right, is it making you lose interest or struggle during real sexual intimacy? Because that's what truly matters. Masturbation isn't separate from your sex life. In fact, it's deeply connected to it. When you do it too frequently, your brain and nervous system start adapting to the kind of intense stimulation that only happens when you're alone. And the result? When the real moment comes with a partner, you can't recreate that same feeling. And if this sounds familiar to you, you're definitely not alone. So, how many times a week is considered normal? That's always a tricky question because the truth is, normal doesn't have a fixed number. Every person has a different body, a different level of desire, and a different lifestyle. But if you really want a number for reference, here's what I can tell you. The most commonly reported frequency among men is 1 to 2 times per week. Of course, some people do it every day, and that's not necessarily a bad thing. As long as it doesn't leave you feeling drained, out of control, or uninterested in real sexual connection. Because the line between a healthy habit and a habit that distorts your natural sexual response can sometimes be just a few sessions apart. I'm not saying masturbation is bad, and science doesn't say that either. In fact, frequent masturbation, when done in moderation, doesn't cause any long-term health problems. But the real issue starts to show up when you no longer feel satisfied during real sexual intimacy. And this is something I've come across through countless stories shared with me. Some men, especially younger men, struggle during actual sex. Not because their bodies are broken, but because they've become too used to the way they stimulate themselves when masturbating. More intense, faster, more focused, more controlled, and often paired with pornography. Over time, their bodies begin to reprogram, only responding to the kind of stimulation they've created alone. And the result is, when they're with a real partner, they can't recreate that level of arousal. You see your partner, but feel nothing. You want to be intimate, but your body just doesn't respond. And that's the most dangerous blind spot of excessive masturbation. It's not that you lose your sexual ability, it's that you lose your ability to connect. I often get asked this question. Does frequent masturbation reduce your chances of having children? And the answer is, yes, if you do it too often, especially at the wrong times. Our bodies are all about balance. Too little sex? Not good. Too much ejaculation? Also not good. This is especially true for couples who are actively trying to conceive, because timing and frequency matter a lot. If you masturbate and then have sex later the same day, there's a clear possibility. The total amount of sperm you release will decrease. And that means your chances of conception go down, especially if that happens to fall on the woman's ovulation window, the golden time to get pregnant. So, if you're on the journey to becoming a father, don't let a personal habit get in the way of a bigger goal. The key isn't to completely abstain, it's to adjust at the right time in the right way. Aside from masturbation, if you're worried about your fertility, here's something you should know. 1 in every 6 couples struggles to conceive, and in about 50% of cases, the issue lies with the male partner. Yes, it's not just women who need to get their hormones or reproductive health checked. Men also face a range of factors that can affect fertility, many of which are silent, with no obvious symptoms. One of the most common causes I've come across is varicocele, enlarged veins around the testicles. This condition exposes the testicles to higher than normal temperatures all day, every day. And here's the thing. Your testicles are located outside your body for a reason. They need a cooler environment to produce healthy sperm. When that environment overheats, it doesn't just reduce sperm count and motility. It can even damage the DNA inside your sperm. Low testosterone is another major factor that can impact male fertility. And then there are rare cases like blockages in the vas deferens, where the body produces semen but no sperm can actually exit. So, if you've always believed that fertility problems are only a woman's issue, maybe it's time to take a closer look at your own health and explore the factors you may have never considered before. If you seriously suspect that your fertility might be an issue, here's the very first step you need to know, and it's also the standard medical procedure today. Step 1 is semen analysis. You'll visit a lab, provide a semen sample, and doctors will examine key indicators such as the volume of your semen, how many milliliters you ejaculate, the sperm count per milliliter, the motility of the sperm, how well they swim, and the shape of the sperm, because misshapen or abnormal sperm can't fertilize effectively. Usually, you'll need at least 2 samples collected at different times, as the values can naturally fluctuate from day to day. If there's no sperm in the semen, the next step is hormonal testing, including testosterone, and a few other hormones that regulate sperm production. This helps determine whether the problem lies in sperm production or sperm transport. Finally, there's the physical examination to check for varicocele, tumors, or any congenital abnormalities, such as men who were born without a vas deferens, meaning sperm can't exit the body even though it's still being produced inside. It might sound complicated, but the truth is, once you take that first step, everything else becomes manageable. Don't wait until you've been trying for years to get tested, because fertility isn't just one person's issue. It's a journey that both partners share. So, what if your test results show a low sperm count, and the cause turns out to be varicocele, enlarged veins around the testicles? The most common treatment option is surgery. A doctor will make a small incision in the groin area to tie off the abnormal, dilated veins. This helps lower the temperature in the testicles, restore proper blood flow, and create a healthier environment for sperm production. Here's something many men don't know. You can ejaculate normally, but have 0 sperm in your semen. This condition is called azoospermia, and it's more common than you might think. You could live for years without ever realizing it. That's because only a tiny fraction of your semen actually contains sperm. The rest comes from the prostate and seminal vesicles, providing the nutrient-rich fluid that supports sperm. So the sensation of ejaculation feels completely normal, even if you're not fertile. It's only when you've spent a year or 2 trying to conceive without success, and finally go for a test, that you discover there's not a single sperm in your semen. At that point, we need to distinguish between 2 main types of azoospermia. Non-obstructive azoospermia, where the testicles either don't produce sperm at all, or produce so few that they never reach the semen. Obstructive azoospermia, where sperm is produced, but something blocks its path. similar to what happens in a vasectomy. Obstruction can be caused by being born without a vas deferens, or due to infections, inflammation, or scarring that blocks the sperm ducts. The real issue is, you won't know you have azoospermia unless you get tested. And when you do, many men say the same thing. How could I not know? I still ejaculate. Well, the answer is simple. Ejaculation doesn't mean sperm is present. And that's a truth far too few men have ever been told. So, let's go back to the most important question in this video. Is frequent masturbation ultimately good or bad for men? I want you to listen closely. If done at a reasonable frequency and doesn't interfere with your quality of life, masturbation does not cause long-term harm. But, and this is the part you shouldn't skip, when masturbation becomes too frequent, it can start to interfere with your real sexual relationship. Some men have told me they no longer feel the desire to be intimate with their partners. They're trying to have a baby, but they just can't get in the mood or feel emotionally disconnected. And when we look deeper, a high-frequency masturbation habit is almost always present. Stress from the pressure to conceive, combined with the use of masturbation as a way to relieve stress, can ironically reduce fertility even further. Masturbation itself is not the root cause of infertility or sexual dysfunction. But if it starts taking up too much space in your life, physically, mentally, and emotionally, it can absolutely throw everything off balance. In other words, the issue isn't the act of masturbation, it's your relationship with it and whether or not it's getting out of control. Before we wrap up, there's one question I believe many of you are quietly thinking about. Does frequent masturbation make erectile dysfunction worse? The answer is, masturbation itself does not cause erectile dysfunction. But here's what you shouldn't ignore. It can indirectly create habits that make it harder for you to achieve an erection during real sexual activity. I've seen this happen to many young men. They've become accustomed to the way they stimulate themselves when masturbating, often faster, harder, more focused, and sometimes accompanied by pornography. And that's exactly what makes them unable to recreate the same sensation when they're with a real partner. Over time, the brain and body begin to reprogram themselves, becoming less responsive to natural stimulation, and that's how erectile dysfunction can gradually take shape. So if you're struggling in your sex life, ask yourself, is your solo habit affecting your ability to connect with another person, emotionally and physically? Thank you for staying with me until the end of the video. If you found this content helpful, don't forget to like, leave a comment, and subscribe to Men Health 30. I'm Alice. See you in the next video, where we continue to uncover the hidden but essential truths about men's health.